Hello, thank you. This is Dr. Terrence Bryant. Thank you for allowing me to speak with you today on a topic that's very important for us as ABA practitioners. Going to be discussing today working and providing behavioral services to families from culturally diverse populations. This is something that with experience, for those who may not have the experience yet, you will encounter situations where you'll be providing services to these families. For those of us who have had extensive experience, it's definitely something that we certainly know about. And I just look forward to disseminating this information and providing this discussion on this topic. So with that being said, let's get started. For your CEU credits, if you could use the following code to sign in to the presentation, that will allow you to be able to get credit for CEUs. There's a 1 hour CEU credit that you'll be able to receive for attendance in this presentation. So there is a optional preliminary activity pertaining to implicit bias, where you can kind of self-explore, your tendency to have biases. We all have them, and we should just kind of be aware of that. That's a part of our presentation as well, understanding and being self-aware. So we'll discuss in some detail implicit bias and how that can impact us as practitioners. But if you choose to do so, please go to Project Implicit website. The link is provided here in the presentation, and access the implicit association tests. These tests measure aspects of individual biases and stereotypes. And the instructions are presented here too. Read through the preliminary information and click on the general information tab, general information about the IAT. The IAT is implicit association test. And click the link to proceed. Click on I wish to proceed to access the test. Your tests will be anonymous. Nobody will have access to them. And if you so choose, you can do multiple tests. I would want you to focus primarily on race, since that's going to be a primary area that we're going to be covering today. And, feel free, again, to complete as many as you like. I think that these tests will glean some information about you, if you choose to take them, that will be very important to understanding self-awareness and how that plays into our needs in terms of being multicultural, competent practitioners. So, again, optional. If you choose to take it, I think you'll find it to be pretty interesting. So what are your experiences as practitioners of ABA? Have you ever provided services to an individual or family that was a different race or ethnicity? Chances are, if you've been working in the field long enough, you have. Some folks who may not have quite as much experience may not have encountered those situations yet. For those in thinking about it who's had that experience, think about what were some of your barriers to treatment that you experienced. Some could be subtle barriers. Some could be pretty obvious and very overt barriers. How did you handle those things? So think about, kind of go back and think about those situations where you encountered when you were providing services to someone who was a different ethnicity or culturally in some way was a little different and had different values from your own. Personal example I like to present, and I probably got a number of examples. I work with an Egyptian family, and I was already a very experienced behavior analyst at this point, and I provided services. We had some progress in some areas, but it was seeming like I was kind of hitting the wall with maybe on a relationship basis, in a relational way. I was, and I recall a conversation that I had during one of the sessions about a situation that had occurred maybe a month or so prior, and I knew that during that period of time, say over the past month, it seemed like we weren't really having a lot of follow through on some of the recommendations, and there seemed to be a disconnect between myself and the family. And the mother had mentioned, Mr. Bryant, can I be frank with you? And I said, sure. I said, we always want to be kind of open to, have open dialogue on anything that concerns you. She said, well, about a month ago, I offered you food, and, you rejected the offer. And I remember on a couple of occasions her offering me food, and I said, well, no, I'm sorry. I already ate, or I can't accept food, when I'm working. And that she took great offense to that, unbeknownst to me at the time. So that actually had, and we talked it out, and I kind of went over the code of ethics with her about accepting gifts, which we'll talk about in this presentation as well. But it was so subtle that from her standpoint of her culture and how it's very important in terms of relationship building to accept gifts that are offered, and it's considered rude in our culture to reject them. That very subtle experience caused a rift between us in terms of service delivery. My services were becoming ineffective because I lacked the awareness of the cultural value system in her culture, which resulted in lack of follow through in recommendations, or a couple of canceled appointments. It turns out she said, I didn't really want to meet with you that day because I, felt a certain kind of way about it. So it can be very subtle and things that can go over our heads as practitioners, but we really need to be diligent and understand how differences we're ethnically different from each other, or different cultural perspectives. We need to understand the culture of the families and clients and families that we serve. It can really have an impact on service delivery. So that's just sort of my personal example. I could probably give from different cultural perspectives different examples, but for the sake of getting through the presentation and brevity, we'll continue to move on. What have you learned from working with individuals from different cultural backgrounds? So think about that in your own perspective. Nothing to, obviously, we're going to go over here specifically, but just kind of in your mindset while we go through this, think about what you've learned from working with individuals from different cultural backgrounds. So we're going to talk a little bit now about changing landscape, the changing of the cultural landscape actually in the United States. I'm going to go through this a little quickly. So by 2050, it's estimated that 53% of the U.S. population will be members of ethnic minority groups. So that's pretty drastic change from where we are now. Ethnic minority children will be 60% of all children residing in the United States by this time. Latino Americans are now the largest minority group. African Americans are second. So it is in previous years, African Americans were the largest minority group. Now they have been surpassed by Latino Americans. So that's the segment of the population that's growing most rapidly now. Births in the United States will play a growing role in Hispanic and Asian population growth. So a diminishing portion of both groups will be foreign born. So now we have a lot of our citizens from Hispanic and Asian American population, from the Asian population being born in the United States, as opposed to having immigrant status in the past. And here's a little chart showing the distribution of race groups. And you kind of get an idea if you look at the 2010 census and the 2020 census, and you look at the minority groups, there is some growth and differences that you see even within the past 10 years. Of course, that projection on 2050 is going to look even a great deal more in terms of the numbers of minority groups, racial groups who are in our country. So we'll see, a difference as we move forward as years pass by. Okay, so again, here's a table that talks about the projection. We're looking at 2005 and 2050. If you look closely at the racial and ethnic groups under the share of total, in 2005, 60% of the population was white, and you can go down and see 14% Hispanic, 13% Black, and so on. Projected by 2050, 47% will be white, and then 29% Hispanic, 13% Black, Asian 9%. So you can see the increases, and when you total up all of the minority groups, there will be more the United States will be more of a minority population than the majority, as it had been in the past. So that's pretty telling in terms of where we're headed in projection and in our country. Again, here's a comparison to 1960, 2005, and 2050 population distribution. And you can kind of see how each of the ethnic groups are growing in population. The bar on the right shows the 2050 projections again. So it's very interesting. And we look at these things it sort of illuminates the importance of how we are going to be serving a more culturally diverse population as the years go on. So it's very important that we have an understanding of what's important to those individuals and how their culture shapes their behavior and how we need to understand those variables. Continuing on in changing landscape, Hispanic population in 42 million in 2005 will rise to 128 million in 2050, tripling in size. Latinos will be 29% of the population compared with 14% in 2005. And Latinos will account for 60% of the nation's population growth. And that's fairly staggering. 60% of the nation's population growth will be constituted by the Latino population alone from 2005 to 2050. Again, Black population, 38 million in 2005 will grow to 59 million in 2050, a 56% rise. And in 2050, the population will be 13.4% Black, compared with 12.8% in 2005. So the population growth will be increased in the Black population as well, not quite as fast as the Latino population. Again, more numbers, Asian population, 14 million in 2005 will grow to 41 million. So we see a significant increase in ethnic minority groups as we go along in terms of projecting out to 2050. And white non-Hispanic population, 199 million in 2005 will grow to 207 million in 2050, which is a 4% increase. Note that the non-Hispanic white population has the slowest growth in terms of increase. So, those are some pretty telling numbers. So what does that mean for us? All providers of mental health services will see an increase in service provision to an increasingly diverse group of individuals and families. So it's important that practitioners, particularly us in our field as behavior analysts, understand the cultural nuances associated with ethnic minority clients and develop competency to effectively work within the various cultural contexts. So we're going to talk a little bit now about the different minority groups and some of the characteristics and the importance of those characteristics. For the purposes of this presentation, emphasis will be placed on cultural differences as they pertain to race and ethnicity. Again, culture, is not limited to a discussion of race. Culture has applications in a lot of different areas. It could be the music culture, if you're of the pop culture, or if you're but for the purposes of this presentation, we're going to be focused more on race and ethnicity in terms of our discussion of culture and what that means. Particular emphasis will be placed on African Americans, Hispanic Americans, Native Americans, Alaska Natives, and Asian American Pacific Islanders, and the challenges faced by mental health professionals, in particular ABA practitioners, in delivery of effective services to these individuals and families. So we need to understand these different cultures with respect to the historical context within which they've been in this country. So that's very important because that's something that is shaped various ethnic minority groups in their relationship in terms of their experiences or their ancestors' experiences in this particular context in the United States. Ethnic minorities have an extensive history of experiences in this country that include discrimination, legalized segregation, threats of deportations, and other issues that contribute to mistrust of mental health professionals and government-operated institutions. So that's from the Department of Health and Human Services, a large study that was done in 2001 related to race and culture and certain variables that are dealing with that. It was a Surgeon General study. Many of these historical factors have contributed to the perpetuation of cultural mistrust, which often serve as barriers to effective service delivery and treatment. So oftentimes you'll have minority groups that already have a mistrust of the culture in the United States. And therapy in our country is centered on the Western model. And there have been things that have happened in the past that have contributed to the mistrust, whether it be certain experiments that have been done in minorities that have been wrongfully done, that were unethical, that contribute to these things. So, that's a thing that we're working against as practitioners to overcome in delivery of effective services to these individuals and families. African Americans have an experience in this country that is unique in comparison to other ethnic minority groups. Majority of African American population traces its ancestry back to the slave trade from Africa. And prejudice and racism continue to permeate society following slavery. So we've had Reconstruction and the Jim Crow laws and things like that affected African Americans, and segregation that continued for many years after the abolishment of slavery. And that's had a ripple effect from back then during the Civil Rights era, even to this day. So without being said, needless to say, cultural mistrust of the majority group, resulted from these historical issues. So, when you're dealing with African American families and other ethnic minority groups, for that matter, those are hurdles to overcome if you're from a different group, a different racial group, when you're providing services. So that's something to think about. And something to really have an honest conversation about in terms of sitting down with your client and families, and and discussing services and what's important. So we'll get into some more specific discussion about some of those things as we go along in the presentation. Native Americans, Alaska Natives, have a unique cultural history that is different from other minority groups as well. The history of Native Americans has been tied intimately to the influence of European settlers and to the policies of the U.S. government. Native Americans and Alaska Natives have historically experienced a history in which they were exposed to disease and pushed westward by European settlers. And federal legislation designated to integrate Native Americans into the mainstream society, resulting in loss of land on reservations and significant socioeconomic problems. So you can even see from a different perspective how another ethnic minority group has developed cultural mistrust within our society, and how that can impact receipt of services, mental health services, ABA services, any kind of services that's based on the Western model. Immigration plays a major role in the mental health of Hispanic Americans, as many individuals have had traumatic experiences that prompted their arrival in America. Circumstances that cause various Hispanic groups to migrate greatly influence their experience in the United States. So places where various Hispanic people have come from, maybe there's been persecution or there's been some problems in those areas that influence their need to migrate to a safer place or looking for a better life in the United States. Many Latinos who arrive without proper documentation have difficulty obtaining jobs or advancing in them, and live with the chronic fear of deportation. And Hispanics have historically been taken advantage of by companies looking for cheap labor, as the fear of deportation results in a need to remain silent. So you can see in various historical contexts to this point how different ways in which cultural mistrust has been developed within different ethnic minority groups. For different reasons, these things have developed. However, it's all the same when it comes down to it. It's a barrier to services. And let's continue on. Changes in immigration laws and an influx of Southeast Asian refugees during the 1960s and 70s resulted in a significant increase in the Asian American population. There was the passage of the 1965 Immigration Act, which favored family reunification and discouraged systematic discrimination against Asians. There was a study presented at APA's 2005 annual convention in Washington, D.C., where the researchers found that 74% of Asian Americans in the National Latino and Asian American Study participants said they had experienced some kind of unfair treatment, and 63% attributed such instances to racial factors. Okay, so there is a perception that being treated unfairly, on the part of some ethnic minority groups, it can be attributed to race factors. Real or true. I mean, real or imagined, I should say. These are things that we have to understand and contend with as practitioners. So what is a traditional Western therapy model? Okay, let's talk about that a little bit. In traditional therapy, a high premium is placed on individualism, autonomy, and the ability to become your own person. The values and orientation of many ethnic minority groups reflect a collectivistic approach where the group is emphasized over the individual. So that's where there's some incongruence with our traditional therapy model, which promotes autonomy and individualism. That's in direct contrast to many ethnic minority groups that place an emphasis over the whole group as opposed to the individual. So you can kind of see where those things don't mesh too well. As a result, culturally diverse clients often do not share many values and characteristics seen in both the goals and processes of traditional therapy. Okay, so let's talk about collectivism and what that means, what that is in terms of various groups, and how that looks. Collectivistic cultures are characterized by a worldview that values interdependence, belonging, and group cohesion. Instead of promoting individual needs and personal identity, ethnic minority families tend to have a family and group orientation. So the group and the family is emphasized over the individual. Family structures such as the extended family and intergenerational family networks are common in ethnic minority families and reflect the collectivistic worldview. So you'll see extended family networks being very important in terms of rearing children. Many times grandmothers and your great aunts and uncles as well are very influential and instrumental in some of the practices and the parenting practices in terms of dealing with children and their development, their growth, not just the mother and the father. So let's talk a little bit about the extended family. The extended family is a cultural norm that can be easily misunderstood in therapy when the nuclear family is used as a frame of reference. So mom and dad, brother, sister, and the dog, and 2 cars in the garage is not necessarily the status quo for many minority families. That group tends to be much larger in terms of the circle of influence for the individuals we serve. African Americans have traditionally found support in the extended family network and the church during times of need. So Chang and Liu note that Latino cultural values and beliefs include familismo, which is family interdependence, respect, and personalismo, the mindset that values human relationships over formal rules and regulations. So as you can see, we're looking at a situation where individualism is not necessarily promoted as much so as collectivism and the family unit. Native American families believe that the tribe and family take precedence over the individual. Asian and Pacific Islanders' cultural values when it comes to family function place an emphasis on interdependence. Treatment approaches that do not take into account these supportive entities may be counterproductive, thus reducing treatment effectiveness. So that's something that we, really have to wrap our arms around and understand how we can adjust our approaches to respect the core values of these families. And we'll talk a little bit about that, how we can do that in a moment. It's very important to consider the role of multiple family members in the treatment process, as grandparents, aunts, uncles, and other related individuals often play a significant role when it comes to providing care and shaping the behaviors of the clients that we serve. So you may have clients where mom and dad may sign the consent. The kid spends time with grandma, grandpa, maybe with an aunt or an uncle. Maybe these relatives live in the home. We can make a huge mistake in discounting these individuals and focusing only on the parents, the biological parent, and discounting those individuals because they can be very influential in terms of shaping behavior and what's being taught and those types of things. So they have to be a part of our treatment plan. We'll talk about that a little bit more in a moment. Even non-related community members, fellow church members, mentors, coaches often have a significant role in the everyday lives of ethnic minority children and may require consideration when assessing behavior and developing treatment plans. So community members can be a very important entity as well in the lives of families from ethnically diverse populations. In short, the caregiver role could very well extend beyond mother and father when providing services to ethnic minority clients and families. So let's talk a little bit about parenting practices and culture. There is a substantial amount of research on authoritative, authoritarian, and permissive parenting styles as it pertains to the influence of culture on parenting. European American parents of adolescents are more likely to engage in authoritative parenting that emphasizes the growth of separation and autonomy within a supportive and responsive relationship. So European American parents tend to be more authoritative in terms of their parenting approach. Latin American, African American, and Asian American parents tend to engage in authoritarian parenting with this greater emphasis on obedience and conformity. In a study of parenting attitudes as measured by the Adult Adolescent Parenting Inventory, researchers found that Asian American and African American mothers supported the use of corporal punishment more than Hispanic and European American mothers. This parenting attitude tends to be in conflict with the core values of ABA, in which reinforcement is always emphasized over punishment. The question becomes, how do we respect cultural values while maintaining our core values as ABA practitioners? And that's the balance. In ABA, we do emphasize reinforcement over punishment procedures. However, when you're working with a family who embraces, when you're working with a cultural group who embraces the use of corporal punishment and using punishment as a primary mode, how do we work within our core values while respecting the core values of that particular group? So that's something that we always got to be very cognizant of. And in my experience, I've seen people say you should never strike your child, you never spank, you never do that, and they're quickly out of the house. Let's change providers. This is not working. So we have to really take into account the balance in terms of emphasis of reinforcement, but also respecting those family values where punishment is one of the core values. And there's a tightrope what we have to do there. Okay, ABA methodology and culture. We're going to talk a little bit about that now. One particular area in which attention to cultural diversity is warranted but minimally researched is in the delivery of applied behavior analysis services to minority families. So we don't have a lot of research in terms of studies that have been done in terms of application of our services and our interventions and the effectiveness with minority families and considerations of their values and those types of things. not a highly researched area. Much of the research on the delivery of applied behavior analysis services to cultural minorities have been focused on the families of children with autism and other developmental disabilities. While ABA has traditionally been associated with the treatment of autism and related developmental disabilities, this mode of therapy is becoming more and more prevalent in the treatment of non-disabled individuals and families. So where we may have roots in treatment of autism, and we're highly respected in terms of our effectiveness in that area, we're growing in terms of treating a lot of more typically functioning individuals and their families. So that's something that we got to really focus on in terms of how our treatment approach is going to be impacted by cultural values. The field of applied behavior analysis provides an opportunity for clinicians to experience numerous cultures, as the objective is often to train parents and caregivers in scientifically verified treatment approaches geared toward behavior change. It is often during this process of parent training that the unique cultural characteristics of the family are not considered. Because operant conditioning principles are inherent in positive parenting interventions, it is very important to understand potential cultural conflicts that might arise when working with culturally diverse populations. It is very important that the ABA clinician develop multicultural competence to provide effective services to their clients. So it's just very important for us to understand, the cultural fabric within which we work in terms of working with ethnically diverse and racially diverse populations, so that we can effectively apply our principles in terms of what we're trying to do in the ABA service provision. So, multicultural competence, that's a very, very important thing that we have to address and we have to develop within ourselves as practitioners. If you were able to take the implicit association test, recognizing your own implicit bias is a part of developing multicultural competence. Hopefully you're able to do that. If not, if you see fit, please try to take that and see what types of unconscious associations you might have that might interfere with your delivery of services as a practitioner. While the science of behavior analysis is based on empirically verified principles of behavior change through operant conditioning, cultural differences can serve as a barrier to the effectiveness of this process. One dilemma that is faced by mental health professionals is the need to develop a closer interpersonal relationship within the cultural framework of the individuals served. So a lot of times we find ourselves wanting to get in and, let's solve these problems and let's figure it out. Let's do an assessment. Let's figure out what the function of these behaviors are. Let's just provide these recommendations to the families. Man, we're on it because we know ABA and we know we identify function and we can develop interventions to increase functional equivalent appropriate behavior, yada, yada, yada. Let's just go ahead and develop this plan, this treatment plan, and let's get after it. A lot of times when you're dealing with ethnic minority populations, it's so important to establish a relationship. Even though we're eager and we think we got the answers, we won't be able to realize success without establishing that relationship oftentimes when we're working with culturally diverse individuals. So we got to kind of keep that in mind, that sometimes it's about setting a tone and establishing a interpersonal social relationship, because that's a very important value in many culturally diverse populations. Rapport building is an important aspect of behavior analysis services when working with families. So we already know that in general. Saldana in a 2001 study noted that rapport building is a critical component of competency development. So that's a part of our developing multicultural competence, is developing the skills for rapport building. Due to the tendency for most ethnic minority families to value close interpersonal relationships or interactions, it is important for the initial sessions to center around some level of rapport building. So building rapport is a very, very important component. We're working with people from ethnically diverse populations. In respecting cultural diversity, there is frequently a need to develop a relationship outside of the therapeutic relationship. Frequently, culturally diverse populations require a treatment approach that makes it difficult to avoid multiple or dual relationships with the client or patient. We talked about personalismo earlier in terms of being a core cultural value within Hispanic Americans, that population. So taking that into consideration, although the first meetings might be quite formal, once trust has developed, the client may develop a close personal bond with the clinician. So, and that's a great thing. But we have to also understand that and recognize that there, with that close bond, there may be some expectations developed. Maybe we're seeing the clinician aside from or outside of a therapeutic relationship, and that puts us in a position of potentially developing a multiple relationship. And we'll talk about the balance of that as we go along here from an ethical standpoint. A closer therapeutic relationship could be interpreted as a significant bond on the part of the client. Clinicians may then be perceived as a family member or friend and may be invited to family functions and given gifts. In this and related cultures, it may be considered rude to turn down such offers of kindness and may serve to negatively impact the treatment process, as I alluded to earlier with the Egyptian family that I work with. I turned down offers of kindness, not to be rude intentionally, but it was interpreted that way, and that did affect the treatment process. That's just one of many examples I could provide, for various things that I wasn't aware of, cultural nuances that impact the services. Many of you who've provided services probably have already engaged in or experienced some of these types of dilemmas as well. So us becoming more culturally competent will reduce the frequency. It won't totally eliminate it necessarily, but it can reduce the frequency of these occurrences and allow us to have more consistency in our treatment. So let's get into ethical considerations. As we kind of talk about multiple relationships and gift giving and those types of things, we do have ethical guidelines, and there's been a recent revision to the ethics code that we'll talk about here briefly. But we have ethical guidelines to address these situations. How do those ethical guidelines fit with cultural diversity? Well, some of the changes in our code of ethics have been the result of dilemmas faced by practitioners in these areas when they're dealing with culturally diverse individuals. So let's go ahead and get started on that part. So in the prior ethics code, the standard 1.06, it was a general overview of multiple relationships and conflict of interest. Guidance on multiple relationships is somewhat vague, in terms of the previous code, the professional and ethical code for behavior analysts, that prior code. Some of the examples provided or what we needed to do, it didn't speak to specifics in terms of how we address some of those issues in terms of avoiding multiple relationships. In terms of gift giving, it did, in terms of standard 1.06, it did specifically state just don't do it. So there was more specific guidance on that particular part of the code, and it was also combined with multiple relationships. So there was more guidance and specificity when it came to talking about gifts. We just avoided them altogether. We just didn't do it according to the previous code. So behavior analysts do not accept any gifts from or give any gifts to clients because this constitutes a multiple relationship. That's pretty clear. Specific direction is provided regarding gift giving and receiving, and any instance of gift giving constitutes a multiple relationship and is an ethical violation. So again, 1.06D regarding gift giving and the prior code was very, very specific in terms of there was no wiggle room, leeway, or anything. We just didn't do it. So the revised code that we just started here in January 2022 more specifically covers potential areas that could constitute a multiple relationship, including professional, personal, and familial relationships with clients. These things weren't indicated in the prior code. It just pretty much had vague generalities about multiple relationships and things of that nature. However, this is covering more specific information in terms of areas where those things could potentially occur. The standard also discusses safeguards to take when immediately resolving the multiple relationship is not possible. So again, the prior code just stated don't do it. This one, the new one, discusses some safeguards to take, if we find ourselves in a position where multiple relationships have occurred. The issue of gift giving in this particular ethical standard was addressed as a separate ethical standard. So no longer was it combined under the standard for addressing multiple relationships. It was teased out and is addressed as its own separate standard. So gift giving has been addressed in an additional ethical standard in this 2022 revision, which covers provisions for acceptance of gifts, which we will get into in just a second here. Ethical standard 1.12 of the Ethics Code for Behavior Analysts covers ethical considerations as it pertains to giving and receiving gifts. Gift giving as an expression of appreciation is an important value for many culturally diverse families, and refusal to accept gifts can potentially serve to impair the therapeutic relationship, which we've already discussed. In light of the impact of culture in this area, there have been recent revisions to this ethical area to include parameters under which small gifts can be received. Again, recall, it was just a no-no in the prior code. Now there's been discussion of some parameters in which small gifts can be received, which is, I'm sure the changes in this code was in relation to situations that practitioners have come across related to culturally diverse populations. So again, what contributed to the changes? Like prior revisions to the ethics code, change is driven by ethical dilemmas that we encounter as practitioners and the need to reevaluate the right thing to do. These changes are very relevant to work with ethnic minorities due to the need to balance the need for closer interpersonal involvement through rapport building and ethical service provision. So we have to balance those things. While imperfect, the current revision to the Ethics Code takes into consideration some of the cultural values of the diverse client population that we serve. So again, we're not just arbitrarily revising the code. We've encountered situations where we're not being effective as we should due to cultural values that diverse populations hold. And these things, to the credit of folks who work on these ethics committee, these things have been taken into consideration, and we're working toward guidance on how to more effectively provide services to these individuals by relaxing some of those standards or giving additional guidance on how to operate and provide services with these cultural values in mind. So in terms of considerations for ABA practitioners, while the recent revision provides us with a bit more detail on what constitutes multiple relationships and allowance of giving and receiving gifts, it's still important to remain vigilant in maintaining therapeutic boundaries. So again, we have a balance. We want to take into consideration those values expressed by members of ethnic minority communities, but we also have to be vigilant about staying in terms of maintaining therapeutic boundaries, not developing too close of a relationship. It can be a tricky balance. It is important for practitioners to establish an understanding of the ethics code by the families. So you want to talk to the families about your code of ethics and have them understand it. So establishing that understanding of that ethics code by the families that they serve at the outset of services, particularly those areas of the code that are likely to be relevant during interactions with culturally diverse individuals. Areas that would likely be an issue, certainly multiple relationships, because there is a need to, on some level, develop a closer bond, as values of interdependence and closeness and all of those things are very important to many diverse populations. So we're always balancing kind of how do we do that without establishing a relationship beyond what's allowed from an ethical standpoint. Intake documentation should include a memo of understanding that includes expectation of services and ethical guidelines that should be adhered to. Again, we want to educate them on our role as practitioners and the ethical guidelines that we have to follow. at the outset of services. This just at least provides information so that perhaps offense wouldn't be taken in certain situations because, that's, Terrence's, code of ethics he has to follow. Even though I may not be totally comfortable with it, I understand. And we want to make sure that we present that information so that, families understand where we're coming from as therapists. So let's revisit multicultural competence. Another consideration in the provision of culturally competent ABA therapy is for the practitioner to develop the skill of self-reflection. When working with individuals and families from ethnically diverse populations, it is important for the mental health professional to acknowledge the worldview of the client in comparison and contrast to their own worldview. So we all have worldviews. I have a worldview, and the way I see the world through my experiences and through my family experiences. My clients have a certain worldview and a way of seeing life and seeing the world through their experiences and their family experiences. So we have to kind of understand that going in and acknowledge that our client's worldview may not be like ours. And, that's a part of the self-reflection process. How I see the world may differ from the way my clients see the world. And we don't want to make the assumption that we all see it the same way. While efforts have been made to promote training in multicultural competence at APA-accredited institutions, there have been minimal requirements for behavior analysts to receive training in multicultural competence. So it's not an area where we've really done a lot of work in or we've done a lot of training in to this point. Hopefully that changes in the years to come. It would be beneficial for ABA practitioners to develop multicultural skills through their training, supervised experience, and continuing education to understand how the cultural context affects the conceptualization of the client's problems. Fong 2016 proposed 3 recommendations for increasing cultural awareness within clinical organizations. So let's look at those. So recommendations for these organizations: identify an individual within the organization who can ensure that cultural awareness is addressed. Now, this person may be responsible for identifying points for supervision discussion. The person may develop best practices for cultural competence, and the person should also serve as the role of an ethics coordinator. So this is probably going to be your person who does a lot of supervision training. They're very involved in terms of making sure that the agency, organization is delivering effective and ethical services. Maybe that person does some surveys with families and to assess their values and, satisfaction with services and things like that, and anything that we could do better or questions about what they see as important in the service delivery model to their child. Sometimes we get information through surveys and through asking families questions and things like that about what's important to them. Recommendations continue: incorporate cultural awareness training into individual supervision. So supervision questions in which cultural conflicts have arisen during services. So for example, conflict between the intervention and parenting styles. So like maybe you're making an intervention recommendation and there's a conflict between what that parenting values and interventions that they tend to use based on their cultural outlook or what they believe in or what they hold as valuable within their group. So sometimes we often run into we might run into a situation where we're emphasizing reinforcement and the parent might be like, well, no, he has to be punished for that behavior. That's one of our things and what we do in our family that we don't let slide that way. We have to take care of it that way. Well, there's going to be a conflict that may arise there. We always want them to learn reinforcement principles, but we may have to balance some of that with their parenting style and outlook. Development of fidelity checklists to be used during supervision with items that assess cultural awareness during assessment and intervention. Again, from a supervision perspective, we want to assess, our supervisees' understanding and awareness of cultural issues or potential issues that might arise, and understand assess their cultural awareness. Because a lot of intervention recommendations, if they're not culturally aware, will not be with respect to the individuals they serve in terms of what's important to them. And if we want to ensure that our interventions are carried out, and that we can, effectively provide services, that's going to be a very important thing to consider. And also incorporating cultural awareness training into group supervision and training. So difficult or important questions that arose during individual supervision can be addressed in this group format to allow for more perspectives to be brought to the table. Discussion in the group supervision format should be facilitated by the company expert in cultural competency to ensure that topics are adequately addressed. Again, this might be the ethics coordinator if exists one of those individuals in the organization. That should be facilitated by that person so that we can, address issues as they come up. The approach to developing skills in multicultural competency can be reduced to two major areas of focus: knowing thyself, or understanding one's own worldview and outlook, and knowing your client, understanding the worldview of those that we serve and their families and community. So let's talk about knowing thyself, our biases. Again, if you had the opportunity to take the Project Implicit, go to the Project Implicit website and take the implicit association test. Some of these things, might be familiar to you that we're going over, or you might say, oh, okay, I see what I was doing when I took that test. If not, I do urge you to take an opportunity to take the implicit association test. One approach to knowing thyself is to understanding your potential biases. Okay, so we must understand our potential biases that we possess. Implicit bias reflects unconscious attitudes or stereotypes attributed to groups of people. Implicit bias affects our decision-making and our interaction with others. And our services are always shaped by decision-making, assessment and development of treatment recommendations, and our interactions, delivery of recommended interventions to those we serve. So our services are shaped by decision-making and our interactions with the ones we're providing services to. So it's very important that we understand certain unconscious, things, associations that we might hold that we're not aware of. Understanding the biases that we hold, and we do all have biases, allows us to eliminate their influence when we deliver services. Okay? So it's like in the scientific model, we want to eliminate extraneous variables that can have an impact on our experiment, so to speak. Well, we're science-based as ABA practitioners. We're always trying to eliminate bias, eliminate those extraneous variables. So whatever strategies or methods that we can utilize to do that obviously makes us more effective as practitioners. So strategies to control for implicit bias. So self-assessment measures, tools that can determine important aspects of one's values, interests, views, etc., which are related to one's identity. Okay? Important areas in ABA where self-assessment is important for the practitioner include tools that measure attitudes toward cultural diversity and multicultural sensitivity. Examples of such tools that can be taken to measure potential biases include the Cultural Diversity Awareness Questionnaire, the Multicultural Sensitivity Scale, and the aforementioned implicit association test. So let's talk about knowing our clients and their worldview. So culture, which we've been talking about extensively to this point, is a reflection of attributes, attitudes, beliefs, and worldviews that are unique to a particular group of people. One's worldview can be thought of as the lens through which an individual from a given culture interprets the world around them. The concept of worldview is an important consideration when it comes to our interactions with those who have a racial and or cultural identity that is different from our own. Again, worldview is very important. Understanding our client's worldview is going to be central to whether or not we're effective as practitioners, because we do need to understand our own worldview and understanding where there might be an incongruence between ours and theirs so that we can consider theirs in our recommendations for treatment. That's going to only make us more effective. So one approach to knowing our clients is to gather information and develop treatment strategies through culturally informed assessments. So there are some specific assessments that we can kind of use, maybe not necessarily developed within the ABA community, but has application, in some form or fashion to some of the things that we're trying to accomplish in our services. Culturally informed functional assessment. This is an open-ended assessment and treatment interview designed to facilitate the development of treatment recommendations with clients whose cultural backgrounds differ from that of the therapist. The goals of the assessment are to A, define problems accurately, B, demonstrate respect for the client's culture, and C, negotiate solutions in a manner that is acceptable to all parties involved. Now, does that mean for C, do we just say we totally submit to every cultural value that particular individual and family has? Well, our goal, again, is to utilize our science to improve behavior. So we're trying to negotiate and balance, have the balance of respecting their cultural identity, but also respecting our own scientifically verified methods of behavior change, or in treatment practice. So we're not doing everything on one side. We're trying to balance those things out. Culturally informed functional assessment. This was originally developed for work within the field of cognitive behavior therapy, but could be beneficial to providers working with caregivers. The culturally adapted response evaluation survey is a structured interview tool that assists practitioners in obtaining culturally relevant information related to implementation of functional communication training, which is a big thing in our field in terms of developing appropriate replacement behaviors and that can be used to gain access to the things that the client wants. So the culturally adapted response evaluation survey is administered in two parts. First part of the survey addresses what type of functional communication response the caregiver finds appropriate, or the replacement skill. And the second part of the survey assesses the caregiver's acceptability of the functional communication response. So, we're talking about in the second bullet here, does the caregiver, based on their cultural values, do they have respect, or do they accept the recommended intervention here, which is very important. That's where we're trying to get to a point of that we have respect for their values and that they buy in to what we're trying to do. Culturally informed assessments allows the inclusion of the family who is most competent in cultural contingencies related to the behavior and the development of the treatment plan and goals. Now, we might have a lot of understanding of principles of behavior and motivations and why people do what they do, but the family is the most competent in the cultural nuances and contingencies that surround behavior within their particular culture. So we have to understand and educate ourselves on these cultural contingencies and have an understanding of the influence these cultural nuances have on our clients' behaviors that we serve. So recommendations for ABA therapy with culturally diverse populations. So what are some of the recommendations? How do we do it? Based on the considerations of the cultural diversity reflected in the family practices and cultural values of ethnic minority groups, there are some recommendations that should be considered when providing ABA therapy. Due to the variability that sometimes exists within ethnic minority groups, practitioners should not generalize these recommendations to all cases and maintain flexibility in evaluating each situation in a highly individualized manner. So even within ethnic minority groups, there is some variability. African Americans hold some values that might not be consistent with Haitian Americans, Jamaican Americans. So within a cultural minority group, there can be some variability. So we can't just assume that, okay, all the people in this group hold these values in particular, And I should just, okay, so since I know I'm working with them, I can treat it all the same. We have to kind of be really vigilant about understanding the nuances between each ethnic minority group as well that exists. So that's something to really be take into consideration, and it's something that's very important. So recommendations, number 1, build rapport. We talked about that a little earlier. The logical first step, but often ineffectively carried out. So we miss the boat on this one sometimes quite a bit. We don't effectively build rapport. Mistrust of practitioners of mental health services is fairly commonplace among ethnic minorities. It's important for the ABA practitioner, particularly one of a different race, to establish rapport and trust in an initial meeting. May need pre-assessment meeting prior to the initial assessment to establish rapport, discuss the values that the family holds dear, and discuss outcomes they hope to see. We tend to get in there and say, okay, we got to go do this assessment. And we just collect all our assessment data, do scales, do ratings, interview the family, talk about, what's going on. And then we try to write up our assessment report so we can request services. A pre-assessment meeting, and I've done these personally, where it's not necessarily a build meeting or whatever, but it's a pre-assessment meeting just to take about 20, 30 minutes to just say, hey, I want to have an initial meeting before we do our assessment, just to get, introduce myself, first get to know each other and have a discussion and talk about what's important to you. That goes a long way in building rapport and establishing a great therapeutic relationship with families who need that type of interaction, who are already mistrusting of services. So a great technique, I think, in having a pre-assessment meeting, and getting off on the right foot. Also discuss any concerns that the family has about services, as well as an honest discussion about issues pertaining to racial differences. We look at each other. We look different. That may be a thing. Maybe not necessarily for the practitioner, but for that family member. So having an open and honest conversation, in terms of their preferences and, in terms of if there are any things, that we could air out in terms of us being different and maybe looking different. It may be a little uncomfortable discussion, but there are ways of leading into that and just making sure that everybody's okay with each other, and and that's not an issue from the outset. Even if it is an issue, how can we, go ahead and at the outset work around it? Number 2, understanding the family dynamic and worldview. The ABA practitioner needs to understand behavior from the perspective of the family's value and belief system. Ask questions about parenting style and views on discipline. This is very important for us to do, because that's going to be directly related to acceptance of some of the recommendations we're going to be making in terms of behavior. Inquire about any spiritual beliefs and practices that the family holds dear. Very important once again, too. Spiritual life for many culturally diverse individuals is very important. Ascertain their perspective on reinforcement or reward. What does it look like to them and their family members? Assessments and intervention procedures, to the extent possible, should fit within the framework of the cultural context. Now, again, are we going to totally compromise our procedures and our interventions and things like that? Not really. The principles are still, the underlying principles of what we're doing should stay the same, but we have to be creative in how we tailor our interventions with respect to the cultural values of the folks that we work with. So we have to find that balance and work and have them as being an active part of the treatment plan development process, and having their views and their values incorporated into what we do. Number 2, continued, understanding if the family is patriarchal or matriarchal, individualistic or collectivistic, can foster a strong therapeutic alliance and open the door for acceptance of treatment recommendations. So be sure to establish inclusivity of all caregivers and family members. Remember, many individuals from ethnically diverse populations or minority populations in particular operate from a collectivistic standpoint. So just talking to one family member, mom or dad or parents, and not considering the grandparents or other family members who may be right there, is something that can impact our ability to be effective in our service delivery. Ask for and value the perspective of each family member and when it comes to the problems that are being addressed. So get everybody's perspective, because everybody interacts with the individuals we serve, and everybody influences them and influences their behavior. So get everybody's perspective. Ask if there is a primary decision maker in the home, and include that individual in the consent and treatment plan development process if applicable. Here's another area where I made a mistake earlier in my career, where African Americans families tend to be more matriarchal. So not in all cases, again, we got to be careful with that, but there's a tendency for the mother to be sort of the primary influence on the child, and maybe even in many cases a primary decision maker. So I was operating, obviously, unbeknownst to me, from the view of, well, I got to talk to mom. Mom is going to be the important person here to get this important source of information. And I was working with a Hispanic family. Well, Hispanic families tend to be patriarchal, and having that father's input and influence is extremely important. So I was not really getting forward with this family, and I was trying to, even though I was speaking a lot with mom, dad was kind of hit or miss, and I don't think he felt very included in the process. Not that I was trying to exclude him, but I found out later that greatly impacted my ability to provide services to the family, because at the outset, I didn't have the respect in terms of pulling dad in and valuing, where he stood on the issues in the family, and just really understanding, his influence within that family system. So again, being culturally different can impact your ability to recognize these things and deliver services effectively. Number 3, assess the family's views on parenting. Understanding parenting views and family values from the perspective of the ethnic minority families can result in valuable assessment information that can inform culturally adapted interventions. So we want to assess the family's views on parenting, and to tailor our, strategies, based on some of these parenting views. Recommended tools for assessing include the culturally informed functional assessment, Alabama Parenting Inventory, and the Adult Adolescent Parenting Inventory. Now, these tools weren't necessarily created specifically for ABA practice or ABA practitioners to use in their assessments. However, it does have information in them that are important for us to know as practitioners in terms of assessing family values and views and things of that nature, so that we can tailor our interventions with those things in consideration. Assessments that are more common to the field of ABA might be adapted to address cultural values. Some of these assessments include the Vineland Adaptive Behavioral Scales, the Motivational Assessment Scale, Functional Assessment Screening Tool, and the Functional Assessment Interview. So some of these can be tailored or modified to address or take into consideration, some cultural values that might exist within the families we're serving. Assessment of parent views informs us of parenting practices that may not necessarily be congruent with treatment recommendations that are generally informed in the practice of ABA, thus providing potential opportunities for culturally adapted interventions. So we definitely, want to effectively assess the parent views and incorporate them as much as possible in our assessment process and again, in treatment. Number 4, integrate recommended intervention strategies within the cultural fabric. So this step will largely depend on the effectiveness of addressing the previous 3. So building a rapport and effectively assessing the behaviors from a cultural standpoint and all of those things. So if you're effective in those first 3 steps, then this one may be one that we'll be able to perform effectively. Relationship building and understanding the value system of the family will aid in the development of effective interventions. Okay, so it's very important. Developing culturally informed interventions will be an educational process for both the ABA practitioner and the ethnic minority family. The practitioner will develop cultural awareness skills needed for effective services, and the family will more likely learn about and be more accepting of evidence-based recommendations for improving behavior. Hey, we have a great science, and we got a great message to communicate, but the message won't be communicated unless the relationship is established and, the core values of the family are respected and accepted. And then we can certainly utilize our interventions from a culturally informed standpoint, and because the family will then learn how to be effective with the clients that we're working with. Because our goal obviously is to teach certain skills and teach certain principles of behavior change, and then empower the families to engage in those things, and then terminate services. Sort of our goal. But we have to be able to get to first base by having respect and being able to incorporate their values into what we're doing in terms of, our science and what we do. The goal of the ABA practitioner is to recommend empirically verified treatment interventions to improve socially significant behavior. So this may require some deviation from strongly held beliefs on the part of the client. Development of culturally relevant interventions will result in more acceptance of recommendations by the client. So they're going to be more accepting if they know that their values are respected and that their values are indicated in the recommendations that we're making as practitioners. Number 5, establish organizational training and cultural awareness and diversity. This can't be emphasized enough. Many agencies or organizations have no cultural diversity or cultural awareness training protocol in place. We have a lot of folks coming into ABA practice and may or may not have gotten this training in their institutions where they were trained. It's extremely important that as an organization we start talking about these things, having open conversations about the clients that these folks are going to be serving, and building cultural awareness skills and training, and how to carry out services with respect to cultural diversity. Establishing a leader within the organization who is in charge of ethical compliance and supervision training could promote the development of culturally aware practitioners. So we talked about it a little earlier, and that's a very important step. Development of cultural awareness training curriculum and attendance at CEU events where training and delivery of culturally competent services to increase employee skills in working with culturally diverse populations. That's certainly another strategy that we can use to develop our practitioners within our organizations and be more effective in terms of understanding the clients we serve and being able to provide more effective services from a culturally competent standpoint. And we have reached the end of our presentation. In terms of closing remarks, there's a need for flexibility in the therapeutic approach to service delivery with any group of individuals. Okay, so we have to be flexible as practitioners. We can't be too rigid. There is an increasing awareness in ABA of the need for culturally relevant services. So we are on the right track in terms of having an awareness and having open discussions about it. We're not there yet in terms of implementation of culturally aware services. But I think we had an awareness and an understanding that that's an issue and there's something that needs to be addressed. Continued progress toward this goal will require a systemic approach where emphasis is placed on training and cultural competence to facilitate culturally informed treatment. So those are the last things I want to leave you with. I want to thank you for attending the presentation. If there are any questions about the presentation or any questions at all about certain points presented, I can be reached at Dr. Bryant, BCBA-D at fullspectrumaba.com. I want to thank you and I hope to hear from you soon.